few minutes that you're in with that physician that there's a lot of things that are being gapped, including the things in between visits.
We spend a limited time with the patients and we're doing the things we
Right.
can and we're servicing, but there's a whole back end of things that have to happen from the next visit or the visit to the next visit.
Joint aches and pains or respiratory things that need to be better controlled, and they're going to be ongoing, then we're going to want to have a care manager associated with you.
There's so many other things that we're not doing to help our patients outside of just their health.
Sure.
And how do we become a resource for that? Hey everybody, welcome back to another episode of What the Health with the Naaman Bros.
All right, guys. So today we're going to be going over another topic that I think is going to be an interesting topic, meaning that it's something that we don't always talk about and update everybody around. Our patients, they're used to it, but this is a shift in the way healthcare is delivered in communities as well as to individual patients. So
Sure.
The topic is on why you need a care team. So
Sure. So care everywhere, right?
Right.
So again, that is the topic for sure. So care, as far as I know, I mean, some of the few centers or the health systems, as we're now growing and becoming more of a system, I guess, implementing and having had implemented care management teams and creating a whole care-based team. And maybe we should talk with just everybody out there in regards to like what care-based team management is and
I love it.
how that really helps and like why we even started implementing it in our organization and where it goes from there.
So yeah, let's talk about the first thing we want to go over is what does that even look like? So historically, when people were coming in, they would come in to see their doctor and their doctor, they had a one-on-one relationship with them. And you have one patient, one physician, and you're communicating with them. That's kind of an antiquated model of healthcare. That's what we call the traditional healthcare model. You come in there, they know you, you know them, and you're in, you're out, and then the physician's usually again, here's Greg, we've been seeing you forever. Here's what's going on with you. Here's what you need. Blah blah blah, and then the dialogue. Usually, it was a 10-minute type of meeting, and sometimes if it was a full physical, it may be 30 minutes or 40 minutes, and then you get your stuff done, and then you go. What we found over years is that they miss a lot of things, and that's all fine and good. But again, in that few minutes that you're in with that physician, that there's a lot of things that are being gapped, including the things in between visits. So now you don't come in and let's say I had high blood pressure or my sugar's up or I have a family history of this or I'm starting to feel these symptoms and I haven't been seen for 3 months, and all of those touch points in between now are just, or things that happen in my life in between, there's nothing to communicate with the patient about. So the traditional model was, yep, you're getting seen and you go ahead and live your life and then we'll see you again over here. And now we know that, that didn't really work. We weren't keeping the US population healthy and where they need to be, and there was a better way of doing it. So then they started adding on these concepts of other individuals and touch points in between these things, hence the term care team, and the ability for us to then have more touch points until the next visit with a provider.
So I love that. And just to kind of reiterate what you were saying, just to kind of give everybody else, like, how did we get to where we're at today? The long gone are the days where we had the small village of where you would have, let's say, 100 people or 200 people or 500 people that were living in a small town, and you had the doc that took care of everybody, and they were okay with having 500 people in a town, and they were okay with knowing everybody first name, and they would go to their homes and take care of little Johnny or Susie or mom or dad or grandma.
Mm-hmm.
And then we start evolving as a nation, and we start going from a little small village to now all of a sudden we've got big cities where, like, you look at like a city of like Detroit, where there's a population of almost 800,000 people now. You look at like cities like in Chicago, where there's almost 5 million people. And you'd say, like, how could you possibly, as a physician, where you've got one physician and their patient population, where we're pushing them to the limits to max, where like one physician could only really handle about 1,200 patient population. Now you're asking old man Doc Ted and Dr. Greg to sit there until midnight handling their patient population by themselves, because like I can only handle so many patients, and we know that there's a huge shortage in providers in the areas. So as the populations continue to grow and expand, that's a great thing. We want that to happen. But the number of people to be able to serve that population on the healthcare side is not growing proportionally.
Right.
So then what winds up happening is you get physician burnout, where like now we're sitting there in the office until midnight, seeing the patients all day, finishing our charting, going through our blood work and all the different things that come back, and it gets overwhelming, so you can't really handle all that. So you need to like bring in assistance.
Right. So you're getting that physician burnout, as you mentioned, or provider burnout, but you're also getting that whole overload of data because now there's more and more testing that is at our fingertips, right? Now we have all of these different diagnostic tests and biofunctional markers and guideline-derived medical treatments or GDMTs, and we're adhering to those things, and we're constantly learning more and more about these things and how it can impact stuff. So then the provider is getting better and better at what they're doing, but there's now more and more information. And then there's that gap of, so I know these things really well, and that's why you're coming to me. Then I got to translate it, and then it's got to be digestible and into chunks so that way you can actually do it between the visits. So those are going to be the challenges that we've seen. And because of those challenges, now we were like, okay, a different methodology has to be implemented. Otherwise, if you don't do it and you're sticking to the whole traditional model, well, times have changed and healthcare has changed. And if we don't move with those changes, you're going to still be in this whole, yep, I saw my doc, they told me what to do, I'm now doing them or not, right? Because again, it's hard to change habits and behaviors, and there's no one to help me keep accountable. And I didn't understand everything he said because, Dr. Ted's really smart, but he's like, whoa, what did he just mean by that? And I'm still trying to figure out some of these other things, in my life. And it's hard to keep those things in line or to be able to communicate real time back with them. Oh, and we know that Dr. Ted's really busy because he's trying to take care of this whole community and the rest of my family and everybody else that I know. And in that time period, but I have a question or I have a concern, then who do I communicate with and how do I get that back there? And that's where we've seen where and I call it the traditional model, some will call it out there in the community, is an antiquated model of healthcare. Again, the traditional model and where the gaps are and why, again, now a care team model is going to be better. And maybe we can, go a little bit over that. What does a care team look like?
And it goes back to your point. It's like, utilizing the individuals to optimize their strength. So like we spent, umpteen years in training and learning how to deal with medicine, right? So it's learning medications, it's learning side effects, it's learning how the interactions, it's learning about the actual normal physiology of the body and then the abnormal physiology body when things start to break down and all the conditions, whatever. So that's a lot of stuff that we're dealing with. Our patients, we didn't learn how to handle, helping somebody with transportation or helping somebody because they've got some issues with getting their medications, their prior authorization of the 15,000 steps that they have to go through just to get the medication.
Or their MRI, or to get their GLP-1, they got to do all these things, or right.
And that's very burdensome. And number one, we don't have the skill set. I don't even know, I'd have to I have to go through the process of you and figure out how to help you with that prior authorization. A lot of times there's all these things that you have to fill out on these forms and all these barriers, and we have people who are experts in that and know how to navigate that world that are part of the team. So it's like everybody's getting used to the maximum of what their expertise is. So do we want to use physicians who spent a gajillion years learning how to help and deal with your health and using them as secretaries to fill out forms to get whatever? It's like, I could try to help get an Uber to get somebody brought to the office, but do you want me to calling Ubers? And I don't
and then you miss out on the important things that, like you said, that you're trained on and you're skilled in that you should be doing. Right. So, and maybe that's a good segment for us to then say, okay, who is in our team-based model and now these more modern-based things in terms of what does that look like from the new modern era of team-based design healthcare as opposed to the traditional one-on-one care. Right. Maybe you can talk about that a little bit.
So even in our organization, because of the fact of the shortages in having physician primary care folks and or just physicians in general, we've really been working hard with facilitating with our colleagues who we know and love as our mid-level providers, and we call our APPs or advanced practitioner providers. And so bringing them in, having them see the patients, be part of the care team with oversight by physicians. So we work together collaboratively. When we talk about our advanced care team. Bringing in care managers who are essentially people who are skilled at to a certain level that can be part of that can help with things like from behavioral health by transportation or like getting medications, like authorized to be able to get delivered, and all the different things that like each different element of things in regards to your care. And so these are individuals that are all part of the team that are behind the scenes and or sometimes in the front of the scenes, because again, we spend a limited time with the patients and we're doing the things we can, and we're servicing, but there's a whole back end of things that have to happen from the next visit or the visit to the next visit.
Lovely. So yeah, you mentioned some of the individuals or the roles that we have in our team. So you have the supervising physician, you have your advanced practitioners and providers. We have our pharmacists who look at things and do medication checks. We have part of the team is actually, I know that this is huge for you, is the AI, right? So artificial intelligence and these agents that go through and scrub out things. We have people who are helping in terms of the patient experience team, and they're the ones who assist with things like you mentioned, that if they need transportation or they need a ride to the office or they need, some questions answered, these are individuals who can then do all of this stuff. Because again, it's been said before, right? It takes a village. I don't know if that's the saying, but that's what I'm going to say it is.
Sure. Why not?
But it does, and it requires a lot of people now. So, and where these specialized individuals who know how to get the resources needed based off of the conditions, that's how you're going to make sure that these individuals stay on top of it. And I want to really dive deep into I think we just brushed over this whole thing about care management, case management, and how we use that in between these visits. If you could, like us, follow us.
Follow all the stuff, make sure that you hit the like buttons, all those different things that
ring
people are
the
supposed
bell,
to say.
do the thing you're supposed to do, hit the subscribe thing, whatever it is.
Come on in.
Send in the pigeon, carrier pigeon in.
Smoke screens, it's cool.
However else it is that you can. Again, make sure you're following us, and hopefully you'll learn a little something and you'll have some fun.
Yeah. What the hell?
We have our provider visits, and then we set them relatively close to each other, so that way we can assess whether or not there's changes and do more prevention stuff. But in between, if you can touch base on how we use our care managers and case managers.
Yeah. The concept essentially is that there are many things that it's just like a one-off incidental like thing that just needs to get handled today. I just need to get me, this for today because this condition that is, just short-lived and or like one-off thing to just kind of help me with this particular thing. That's when we start talking about like, that's more of just individual case management. You have some specific thing that you really need to work on, you need to get done. Hey, I'm having a hard time getting my sleep machine or tubing or my asthma machine for using my nebulizers. And so those are like little one-off things, or I need, help with getting something, a specific thing in my house. That's more of just like a one-off thing. That's a very short-lived. It's not something that has some chronic thing that's going to need to be continual, ongoing, like your diabetes, management or help or assistance, or, your blood pressure, or weight loss or things like that. And that goes into some of the programs that we can talk about that we've got as well. But like, again, so case management, individual thing. Care management is like, you've got this like longitudinal, like this is a long-term thing. It's not going away. We're going to work together to continue at this thing because this thing is here for the long haul and we're here for the long haul with you.
I love it. So again, case management is, let's say we got into a bad car accident, you just came out of the emergency room, or you, again, had this one thing that just happened and you need a bunch of stuff around that one thing. Then that's just, okay, it's episodic, it's short-lived, but there's going to be some needs in between. We assign a case manager to you. As opposed to care management, which is more around chronic things. And these are going to be things like if you have high blood pressure that needs to be better controlled, blood sugar that needs to be better controlled, weight management that needs to be better controlled, joint aches and pains, or respiratory things that need to be better controlled, and they're going to be ongoing, then we're going to want to have a care manager associated with you because they're going to be communicating with you in between, sending you reminders, notifications, education pieces, helping you with different things, including if there's specialists that need to be brought in, and then the communication back and forth between our team and the specialist. And maybe that's something we can jump into next is this, how does that assist and how does this new modern era of, again, care teams work when patients have multiple different providers or different people that needs to be communicated with. How does that communication work in this model?
Yeah, so for those of you that are not patients of Epic, you need to be asking yourself, people that right now that are taking care of your health, if you're somebody who has some health issues, you need to be looking at those individuals and asking yourself the question, are they just doing everything themselves or do they have support? Because I can guarantee you if they're doing everything themselves, you're getting shortchanged. They're not able to handle all the things that
Things
you
are
need.
going to slip through the cracks.
Right. They are definitely not going to be able to, like, again, or they're the kind of person that they're just so committed that they're there until 3 o'clock in the morning every night. And we know that that burns people out really fast. And that also doesn't get anywhere because then things fall through the crack. So what you really want is you want individuals who have evolved with the times. And so that's essentially what we've been trying to do is, because I know we've gotten like, flack here and there where people are like, well, why do I have to, I just want you to take care. It's like, well, listen, you don't want me to take care of that.
Right?
Right? Like, I'll be the first to tell you, you want me to, like, you want to have these individuals take care of this because I don't know how to take care of that for you. And if you ask me, it's going to either get dragged out or it's going to get done incorrectly. So you want the right people. So we've evolved over time with the times and to try to create systems in place that, again, it's one of the things is everything has to adapt. You have to innovate. You have to evolve with the times to be able to keep up with the times. So the population continues to grow. The population gets older. We get more complex conditions, and people are coming up with all these things, all these different needs. It's impossible just for getting a couple of the old school mom and pop doc of just sitting there by themselves and handling everything. That can't happen today.
Right. So and those patients, what happens with those physicians is that they start to refer out a lot. And that's a key metric of, again, if they're not doing it themselves and they're like, you're going to go see this pulmonologist, this gastroenterologist, this cardiologist, and most of those things your primary care can do. It's just that they're so swamped and they're only in and out in 5 minutes. They're not taking care of it themselves. They're pushing you out to all these specialists. And then what ends up happening is, well, who's coordinating all of that communication with the specialist?
Right.
And sometimes you just definitely need to. Like, again, we have patients who are so complex that we're sending them to their specialist because we have very specific things that we need to answer, and only the specialist has that knowledge base. But now you have all of these different individuals with these complex issues, and it's not coordinated and it's not coming back and communicated. And that's another way that we use our care management team and our care teams. It's the ability for us to coordinate all of that information, siphon it in through one segment or methodology. And then from there, because we've been able to get it all and coordinate it all, we can then put it into a nice summary for us. And that way, when we do see you, we know, okay, there's no duplication of data. There's no repeating of testing. There's no missed things because we're doing it this way. There's no perfect system. Again, I would say that, again, there's a lot of health systems like ours that are trying to do this and still constantly, it's a work in progress, a WIP. But these are the things that we're trying to get to. And that's really the coordination and what we see as the new modern era of healthcare with care teams is moving into. So I want to also, one other thing, bro. So you just mentioned something, and we talked about this a little bit, this whole concept of longitudinal versus episodic. And maybe we can go into a little bit more in terms of that and how we're starting to see this rise of urgent cares and episodic care, and where we're seeing that there's a potential lag because it impacts longitudinal care because more and more people are going into these urgent cares and they're episodic and they're great. But unfortunately, what's happening is now what you just talked about with specialists, you're starting to see that same kind of gap because people are taking their care to these centers and there's no longitudinal stitching of it all together.
Yeah, boy. Great thought process and discussion and topic to talk, because again, urgent care is at one point were like an awesome thing in the fact of that it was like, hey, because when people were having things that were like outside of regular office hours, and also because of the fact that we talked about, many offices have not started to evolve like we have. We're like bringing in like care management teams to kind of help them, to help augment them so that they're not bogged down taking care of the minutia things that physicians becoming secretaries essentially at that point. With that, patients were winding up in emergency rooms for a lot of incidental, episodic things. And so urgent cares were a great thing. They were popping up everywhere in regards to like, hey, we're trying to get them so that we're not going to high cost facilities for like small, minor things, episodic things. But we also know that there's unfortunately a lot of people who look at the healthcare systems as just a business. And so we wound up getting these big conglomerate, venture capital based, private equity based urgent care systems that are popping up on every corner. And then all of a sudden now they're like, hey, we've got all these things. We've invested all this money. Let's try to get the patients in there just for treating their conditions in an episodic center, like their longitudinal chronic conditions in an episodic center, because they're paying a lot of money to throwing up an urgent care on every corner. So they're essentially like, hey, we want to get the patients to come in there, but that starts breaking that continuity that you normally wouldn't have, like in seeing your primary care physician, where you're developing what we call a medical home. So you get into that medical home, you develop a relationship, establish, you've got somebody who's, whether it's prevention and or if you've got some chronic conditions that knows all your stuff and they're backed by a full care team that can help you, as opposed to like these other people that are like, hey, we want to we have urgent care, this PE funded urgent care on every corner. Now they're like, we've got to pay for all this stuff. So we want to get you guys to come over to us for whatever. But they're not established or set up to be that chronic, longitudinal care about your health, be that established medical home. Because just by virtue of their name, they're only there for the urgent episodic thing. So,
I always give the analogy, it's kind of like a large supermarket versus a little 7-Eleven or liquor store, right?
Mm-hmm.
So yeah, you can get certain things done at that center, but you're not going to feed your whole family through a 7-Eleven. Right. You're going to
feed them a bunch of crap.
Right. So you're eventually going to have to take them you're going to have to get to the supermarket, and you're going to have to, again, go there and get all the things that you need for your home, as opposed to, well, I only really need this one thing and it's a convenient thing, so I'm just going to go there. But that's not where I get all my care at. And that's one of the things that we want to make sure that people, again, from how do you think about it differently? And yes, and if you do get your care there, make sure you're walking away with the report that you need to then take it back to your usual provider. You got to make sure that, again, you're taking that information back so that way it's stitched back into your longitudinal care, because we want to track that over time. Boy, it seems like you've gone to an urgent care 3 times around your abdominal pain and nausea, and this could be this other thing because of your other, maybe a reaction to your medications. It could be something else over here, or we need to know that because we need to then make sure that we're telling your specialists and things like this around it. So those are the reasons why we need that information back into more of a longitudinal, because we have the big picture. We have the whole thing in terms of like, oh, we know your whole family, and we know how this, because of your family history and because you're a smoker and because of your other medications, this symptom that you've been seeing at an urgent care, or maybe 2 or 3 different urgent cares, this actually could be this, and we need to test you this way. So we want to make sure that, again, people understand that if you're getting episodic care, that's fine. It's like picking up a cup of coffee over at your 7-Eleven, but at some point, you need to make sure that, okay, I'm still getting all of my care over at my medical home, as you mentioned, and that's where all of these other things can be done, including the rest of the team-based stuff. So just want to throw that out there. Again, I think it's an important thing, and maybe we can circle back to now the next segment of how we at our group in our medical system, how we stitch this all together, and we call that, Stitch Together Health, and how we put them and we connected these dots in these new programs that we've developed. And maybe we can speak a little bit around those programs and how we get patients healthier by having more touches in longitudinal healthcare.
Yeah. As we mentioned before, everything that we do in healthcare is evolving and, and innovating and adapting. So as part of our evolution at Epic and the adaptation and evolving into how can we continue to better serve our patients, recognizing that there are certain things that we see a lot more common, and we recognize that, hey, if we can create a system around these things that we see more common, where we can continue to bring in people who are very specialized and really know that particular thing well. So when we start talking about weight, I mean, man,
it's a big one.
It's a huge one. Yeah. So again, it's one of those things where we talk about how often do we see patients who are very overweight and struggle with it, and creating a whole system around that. And then again, so creating a program around weight loss. Patients who have a lot of pain, that's another thing that we see. And so how do we create a system around individual patients who have a lot of pain, and not just throwing them into some place where that's going to be a pill mill and just get them addicted to some medication, but really working with them on helping with rejuvenate their joints. So not just, again, from the evolution perspective and the advancements that we have right now, we can do a lot of things with like stem cell, protein-rich type of injections, doing things that we can kind of rejuvenate the joints. So it's not just like the old days of just throw some pain pills at them and hope that, they don't get addicted and go down a certain pathway. How do we actually help them rejuvenate their joints? So that's a whole program around that. So again, you want to talk about some of the other ones?
Sure. So again, now moving into that model of care, more longitudinal, and it's around what patients are looking for themselves. So we look at our patients, and as you mentioned, we look at it and we say, okay, we have patients who want to lose weight, but they've yo-yoed back and forth on their diets. So we've created a whole program around how do we get patients to lose weight and keep it off. And it can't be just done by one doctor and one patient. Now we have it as more of a care team designed. And as you mentioned, that includes all different types of specialists. We have behavioral specialists involved in our weight loss program that is more longitudinal. We have, again, nutritional specialists. We have exercise specialists. We have, again, our pharmacy and the team involved in terms of what's really the right medications. Maybe a GLP-1 isn't right for you. Maybe you're not a candidate for Wegovy. Maybe you're a candidate for something else, or that's something better. And then we wrap that with all of that with your care management and with your primary care provider. So all of that now, and there's a whole team backing you up, not an individual. And that's just on weight management. Then we have another one that's just for our women's health. So with our OB-GYN, with our primary care, again, behavioral health, and from other parts of it, including pharmacy, around perimenopause and menopausal health for women, as well as things like if they're having issues or they're thinking about reproduction and fertility, and they're having those kinds of things, where it's more of a program, then you come in on a regular basis and contacts with specific diagnostic testing and labs and all of these things and medication management, and it's personalized to the individual. And then the big one, as you mentioned, that is around our sports medicine and joints and musculoskeletal system. We get a lot of patients who have chronic pain and who have problems with their joints, or they just want to perform better, right? I'm an athlete and I want to perform better. We come into the program, and then you'll have our sports medicine provider with the primary care, with the physical therapist, with a whole team of individuals who will then make sure that you're staying where you need to be at through this program. And that's again, moving back to this whole, how we connect the dots at Epic around this concept of more programmatic health and around the individual, and personalize it that way. And we have things as well that is more around the community. And I think maybe that's another thing that we probably is a whole different segment we can move into next. It's around, so we have our programmed health, we have our care team, but the other thing we want, how do we deliver care into communities? And maybe we can talk about some of our help center concepts and some of the things too, bro. Again, I think we don't do a good enough job at times talking about some of the things that we do as part of Help Center and how we actually interact with the communities that we serve.
Yeah, for sure. It brings you back full circle back to the concept of it takes a village, right? When we look at the evolution, going back to my initial statement, back in the day where the population was much smaller, towns of 500, 1,000 people where it's manageable. Everybody knows each other. You've got the doc who takes care of the whole town. Now we've expanded, and over time, we're also finding that you and I, for the last 25 years, of how many times we've, had to deal with so much more than just their health and the community that we're in. How many times we've kind of come together at the end of a long day, you and I, where we would talk and be like, there's so many other things that we're not doing to help our patients outside of just their health.
Sure. And
how do we become a resource for that to kind of help them? Because again, we've been blessed. We have so many resources ourselves that but we also, when we immigrated to this country, we had nothing. We were, we were the individuals who, again, we didn't have anything. We didn't have insurance. We had to our parents, it was, they had to scratch and claw just to make payment from payment. And we saw that, and we saw them struggle, but we know that a lot of our patients, live that same life. And so the idea of how can we help and create these help systems or help centers where, at many of our locations where we've got extra space, how we can, in the community, use them as a resource for creating the help center.
Yeah, I love it. So again, over the years, what more and more people hear about these things called social determinants of health. And in other words, are the things that are out there that actually are getting into the way of people getting their health better, right? I'd love to come in, doc, but I don't have transportation. Or, that's not important to me right now. I'm still worrying about getting food for my family, right? So food issues or no, I have food, but I don't know what to eat, or I don't know what's healthy, or I don't have time. And it's more of an education piece around it, not necessarily that there's an they have access issues. So we see all of those things, and those social determinants, whether it's, boy, I just don't know who to listen to or trust or read. So it's education stuff, or it's, again, transportation, or it's issues in terms of like daycare even, and things that, or it's like, there's nothing safe for my family to do over in this area where I live. And some of our locations, that's the case. And then we say, cool, we have facilities. We'll use our facilities around there in this whole concept of help centers, as you mentioned. And because, again, every community is different, and we make sure our centers can handle the needs of that community that we see in by and large.
Right. Because it takes a village.
It takes a village, right?
Right.
So I hope everybody learned something today in terms of, again, what a care team is. It's the more traditional model of healthcare versus now the more evolving and more modern healthcare, and where we're moving into. We give you guys a little bit of a flavor of that, and where other health systems across the country, including more proactive systems like ours, are getting into. And again, check it out. And so if you need healthcare and you need a lot of help, and you're still in this traditional model, more than happy. We're always willing to take on new patients. Come into one of our centers, talk to our team, and be part of the team.
Yep. And don't forget to What the Health.
All right, guys. So What the Health. Stay tuned. Remember, subscribe, like, and join us next time for another episode.
Hit the button.